Great. All right. Great. Thank you guys for joining us this evening. This is going to be a really interesting conversation around registration management software and camper recruitment. And I'm pleased to have Ryan Campbell, COCA President-elect, with us tonight to facilitate this discussion and ask some really good questions. So Ryan, I'm going to turn it over to you.
Perfect. Thank you, Jennifer. And if you can go to the next slide, please, because we do have some really nice educational opportunities coming up. Maybe. So that's okay. We have one coming up in March. There we go. We're going to, then February 28th and March 1st, we're doing the Care Camps grant application webinars. Then March 21st, we're doing our first medical town hall of 2023, where that one's going to be about 30 to 40 minutes of a COVID-19 variant update. And then we're going to discuss COVID-19 protocols and what other camps are doing so that we can learn from each other there. Then April 25th to the 27th, our very first ever COCA Staff Training Summit. It is free to all members. We're going to have Professor Dave Malter from Gratz College is going to come and lead 3-hour-long sessions about various staff training topics right before most of us get ready to gear up for our staff trainings in the summer. And more details will be coming out soon exactly about what each topic is going to be. And then on May 10th, we have camper and staff behaviors influenced by a lot more than cancer. Of course, that's Brandon, our COCA president. So before we jump into the topics for the evening, we'll just go over kind of what my goal is for tonight. So hopefully we'll spend about 30 minutes going over the registration platforms portion of it so that we can discuss what works with our platforms, what doesn't work. So then we can also share with our partners, hey, can we tailor this? Or maybe we can all find a different option together. And then the second half of tonight's presentation is going to be a discussion on how we as a community are recruiting campers in 2023. So if you remember in the COVID-19 survey that we did, 93% of respondents said that in 2022, their enrollment was less than it was in 2019. So we'll discuss how we can get kids back where they belong at camp. So with that said, I'm going to open up a poll just so that we have a launching point for tonight. So the first question is about what platform you currently use for camper registration. And if it's other, please put that in the chat. And if it's none, also please put that in the chat. And then number two is what your current camper registration's looking like. Is it higher, lower, or the same as 2022 so far? I know it's super early for a lot of camps.
Need an I don't know on your poll because it's so early. I have no idea.
Yeah, that makes sense. So it looks like we have a good mix here of pretty much everything. And then there we go with the Ultra Camp. Very nice. Okay. So a really nice mix to talk about. We're going to get all angles of this. So I guess my first question is anybody completely in love with the platform that they're currently using? And if so, could you share why? And I suppose if you were in love with your registration platform, you probably wouldn't be on tonight. So that makes a lot of sense. Okay, so let's go around. Let's get address the elephant in the room. You know, what's the main sticking point with everybody's registration process and platform that they use?
Well, for us, until this year, we've always done just regular paper applications. We would mail them to the campers and expect them to get them back to us in a timely manner. And we just recently went through and set up our applications with JotForm because Ryan, you had recommended that. It was a pain in the butt for me to build the applications. I spent hours doing that, trying to figure out how to make the PDFs work. I think I finally got it situated. I sent out the links on Sunday, and within 30 minutes, I had 7 campers apply. So, I mean, that, you know, providing that we can reach out and get the campers, I think the application process will be easy. The only thing that I'm really concerned with is how we're going to get the physicians to sign off on the forms. I think I have that worked out as well, but it's whether or not they're going to participate with that. But I have a backup plan in case they don't participate electronically.
Awesome. And just to echo what Jason said, so we just started with JotForm this year. And like he said, you totally customize it yourself. So on the beginning part of it, getting it all set up is a big pain. That's pretty time consuming, but because we're able to set it up completely ourselves, it's exactly what we need it to be, because we're the ones totally in control of it. So there is a little bit more on the back end that I do manually just to keep track. So whenever a camper registers, I put it in a big Excel file. But the reason we changed is because we originally started with CampDoc because CampDoc had the best medical piece from our perspective, but then they changed their pricing structure, and it was completely unaffordable for us anymore. And then we moved to CampBrain, and we could tell that it seemed like it was kind of tailored to the private camp sector a little bit more than what we needed it to be. And I never had so many phone calls of parents utterly confused on how to register their kids. So that's why we did JotForm. So does anybody use CampDoc?
No, but
Deb,
could you
can you-
repeat what the name of what it is you're using now? I've never heard of it.
Yeah, it's called JotForm, and it has a lot of functions. It's kind of like a Google form thing, but much higher power than Google form, because you can also turn it into an app where you can build your own mobile application, and then families can go into the mobile app, fill out any paperwork there. You can create reports on the back end, and so you can run a report that says, I want everybody that is registered for family camp to show up in this report, and everybody that's registered for summer camp to show up on this report. Like I said, you do have to create it all on the front end, but for us, it's been the most user-friendly so far.
But I can say we also used to use CampBrain many years ago and didn't find it quite met our need. And so we switched to UltraCamp in 2018, maybe 2017. It works. It's not like the most attractive. It doesn't have, it's a lot of work on the front end. Why we picked it was because you can do exactly what you were saying. Any piece of information you put in, you can get out on a report. With CampBrain, we constantly had to ask them, can you add gender? Can you add this? And UltraCamp allows you to select any bit of information from any program and put it into a report. So that was appealing to us. There's a lot of things they don't track. People who cancel, you can't know someone signed up and didn't come. It's just out of the system. They don't have logic linked questions on their forms. So you can't say if yes here and if no, they just move on, which is a big downside for us. And, you know, it's not super user friendly, but.
And you said that was CampBrain or Campsite?
That was UltraCamp.
UltraCamp.
Yeah. Again, what we were looking for was, we felt like we had so many, like who's on treatment and who's getting this med, and we had so many reports that we needed. And it allows us, again, you have to front load it. It's a lot of work to put it all in. I will say that their customer support is excellent.
Well, one of the reasons that we decided to go with JotForm was because it's much cheaper than the other platforms. I think JotForm with a nonprofit is like 50% off. And so we got it for like $594 a year. And again, like Ryan said, we can go in there to the Excel and manipulate what we want to see, what we don't want to see. We can customize the PDF to look like we want it to. Now I found their customer support is not that great, but once you learn how to do it, it's pretty self-explanatory, and I'm happy with the cost of it. So we're going to give this a shot for a while.
And to answer Katie's question, so JotForm also does, I think it was a free upgrade or like really minimal cost to upgrade to make it HIPAA compliant. So it'll show the big HIPAA compliant seal. It covers you with all the electronic documents. It encodes it on the back end so that it's all protected data. And you can actually choose which questions are HIPAA protected. So JotForm always sends you an email of any information that was inputted. But if you say this question is HIPAA protected, then it says data protected for privacy, and you can only see it through JotForm and not through an email. And with the HIPAA compliance, that it also has a signature section. So we have our doctors and nurse practitioners going in and signing it, and it's all HIPAA compliant, and they can do it that way. And it's really nice because we set it so that nobody has to log in. I mean, how many times as a parent ask you, what's my login? I don't remember the email I use. I don't remember my password. So for us, it's just anybody can access it, but you have to prove that you're not a robot and everything. And then once it's submitted, we can only access the answers. And then it has a really nice feature where if the parent wants to X out of it halfway through, it'll automatically email them a customized link to their email where they just click on that link and then they can pick up the application right where they left off. So no need for passwords or usernames. So there we have Kristen said that they use JotForm also for the counselor paperwork. And they use CampMinder for camper and counselor applications as well as camper paperwork. Is there a singular component to anybody's platform that they really love, and that's kind of the only reason why they haven't moved to a different platform yet?
I'll chime in. This isn't the reason we haven't moved to another platform, but CampMinder has introduced a companion app that works well with their application program. And it's nice because the parents, once they're enrolled in a program, so it doesn't work when they've like initially applied, but once they're enrolled in a program, they can access the supplementary materials. So they can do the health history form and stuff all on an app on their phone. And they also have like at camp communication templates, and you can upload photos to the app. And if the parent added like a test photo, for example, of their child, it would automatically tag their child in the photos. So they see their kid in this feed that we're updating daily while at camp. You can send out like newsletters, little like essentially tweets, and then the photos as well. So that's been a really nice addition that they've added. I believe it's at an extra cost, of course, but it is really nice to have.
That's great.
One of the features I like best about Ultra Camp is that they are able to, we do family camp, so they're able to do group reservations, individual reservations, and all our staff. And again, I haven't found anything that anyone really 100% loves, and sort of the limitations that it has work for us. And it has all our histories in there now. And so there's not really a compelling reason to change. We are able to get out the information the way that in any configuration that we'd like. It just doesn't always look as pretty as we would like it to. But again, there are a lot of things about it that I do like.
Ryan, does the jot form allow you to generate like Excel spreadsheets for reports and things like that?
It does, yep. You can do Excel spreadsheets, you can do PDFs on it as well. But thank you for bringing up that family camp piece, Heather, because that was really important for us because it seemed like most of the other platforms that we were using weren't friendly at all to family camp, and that was a big difficulty for us. So it's nice to hear that Ultra Camp does have that feature.
We use Camp Doc, and we, like last year when the price went up, we started looking around, but to be honest, I don't have any paid staff. We're all volunteer. And so we started looking and just, didn't want to make a jump without having fully researched. So we're trying to do some of that this year and then make a decision. I mean, it's got good features. I do like the EMR system for medication management and treatment management. And they've been trying to upgrade some of their registration information. And I do like, I can move kids into cabins pretty easily in the system. So the idea of, as we look, it's what other things are we going to get versus the having to restart over and put everything in, because I don't know on these systems that you're talking about, once a parent or once a kid has come to camp once, does it then just, when they come the next year, does it auto generate and they just have to like review and add in new information, or do they have to redo a whole application every time?
Campminder remembers.
Okay.
Ultra Camp remembers.
Jot form does not, but we have it set that it doesn't. So it clears it. But I think it would remember if we asked it to.
I also want to add, Ultra Camp has a medical tracking piece, so your medical staff can use it at camp. We've never had internet at camp, so we haven't used it until this year when we plan to. So it has a pretty great medication setup that you fill in while you're in the application process, and then you can record all your meds administered and people who got a scrape and that forth, all in the same place. It's nice.
Deb, do you find with Camp Doc that one problem that we had with it is that it seemed like it didn't collect enough information at the beginning, and we were hounding families throughout the spring to fill in the rest of their information, like health history. And then when we went to Camp Brain, we had the total opposite, where Camp Brain wanted everything at once. So the whole application process took like an hour and a half, and then families wouldn't complete their registration because of that. So we've been trying to find a nice middle ground.
You mean in terms of, I mean, we've customized and the content of what we want, but then we also made some fields that they couldn't go beyond and others that they could. And then we set, they will do reminder emails, which you were I don't know if you're familiar with from before, like, if your application's sitting at 75% or whatever, or 30%, or, so yeah, I mean, they can, some of it that they can bypass, that does get a little hard if you're getting close to camp and they haven't finished, but that hasn't been that much of an issue for us.
Does anybody ever have medical personnel from hospitals help out with any portion of the application? So health forms or anything like that? And do your platforms, is it easy for them to do it? Do they have to email it to you on the side and you upload it yourself? How do you juggle the medical professional aspect of it?
We had one of our child life specialists, so that would do that. And so unfortunately, like a lot of the kids were registered under her username. So that,
Us too.
yeah, so that was the hard part, because then it was like, you'd have to remember to go in and put in the parent's username, so that they were getting the information. But that was a little tricky. I'm trying to switch it.
Yeah, I think that's been our biggest difference this year, is because they don't have to log in. Now, healthcare professionals, especially the child life teams, are just going right onto our website and submitting health forms straight through the website. Where before I felt like they would get a little fed up with trying to log in or trying to hunt the family down. So then they would email me the kid's health form, and then it's not HIPAA protected when it goes through Gmail. So it's like, we just bypassed HIPAA, which is clearly not a good thing. So that's one thing I struggled with.
Jennifer, and Ryan too, when you're looking at COCA conference vendors, I'm sure you do. Do you get much response from the different application groups to come out and be a vendor during conference and to talk to a membership?
Well, we had Camp Doc came to Wilmington this year, and it really wasn't until they registered for conference and they realized that there are a lot of COCA members that use Camp Doc. I don't know what the exact number is, but apparently it was a large number. But we haven't had in the past. I would love to reach out to all of these that you guys are mentioning. And so if you have a, contact within these groups, I would love to maybe, get them to come to conference in Chicago. Maybe that's more, of a conference that they can attend and get their interests so they can hear. I think it's important that these platforms hear y'all's ideas and needs and things. So yeah, would love that.
That might even be a great session to have, is the different forms and the activity that it produces, reports that it can produce, that kind of stuff too. I think there'd be a lot of us that'd be interested in seeing it in works rather than have to buy and try.
Right.
Yeah, absolutely. Yeah, and I led a family camp session in Wilmington, and this is really where the idea for this session came from, because so many of us that ran family camp had a lot of difficulty trying to get everybody's information at once. And most of the platforms didn't have anything for families. They were all tailored to campers. So this is something that we'd like to approach. And actually Anthony Kona from Camp Kids Are Kids Chicago, he's a tech wizard, and he had the idea of kind of coming up with a COCA inspired registration platform specifically for pediatric oncology camps to meet our own individual needs. So that it might be a pipe dream, it might be a long shot, but that's that is something that people are considering, trying to reach our specific needs as well.
I know that San Francisco COCA, there was representatives from TechSoup, I think, came and talked about technology. And I'm just wondering, there's I think it's Katera, or I'd have to Google it, I will sometimes go and look at, it compares different apps and technology. I don't know if they have somebody that because I think about things even beyond registration. So I think we had I believe last year we looked at CampMinder. Is that the one that you were saying, whoever has that one was saying that they've got the new app where you can do photos, because it's even how do you, other than, posting on our Facebook and parents going to it, trying to make some things easier for parents to see photos during the week. But that doesn't take a whole lot of time and effort when you're in the midst of trying to do camp either. And I'm not the technology person, so it's
So Gail, who created your registration platform, and what's your experience been with that?
Are you talking to me?
I believe Gail put in the chat when we first logged in that they had theirs custom built specifically for them.
Yes, we did. My husband worked for a technical company or a technical institution, so volunteers kind of stepped forward for us and set it up however we wanted. So we're quite fortunate that way. What it doesn't do is mass email or any of those kind of things. We do that separately, but it produces all the reports. It keeps things coherent for us, up to date. It's easy to manage. We do a lot of transitional summer employment. I'm sure all of us do. So it's the more simple the program, the easier and less easier it is to learn, and the less errors that it is. So it's not complicated in any way, but it's limited.
Sure. So then I'm going to give everybody an assignment I just thought of real quick. If you can, we'll transcribe the chat and give it to powers that be at various platforms and tech companies. But if you could share in the chat either one or two of the things that your registration platforms absolutely in a perfect world must do, whether it's mass email or HIPAA compliant, things like that. Just let's spam the chat with just things that you're looking for in a platform that you may not have now or that you have now that you love. I think that'd be really helpful that we can pass along, and then hopefully maybe we can have a COCA app one day. That'd be cool, right, Jennifer?
That would be super cool.
So then while y'all are thinking of things to put in the chat there, does anybody have any final questions, final thoughts about the registration platform piece? No? Perfect. Okay. So then when we discuss camp enrollment and camp recruitment, if just by a show of hands or in the chat, is anybody else also finding it harder than ever to recruit kids than you ever had before? Because I know in my experience, so we've been around since 1982, and it's like recruiting kids was never even on our radar. They just we stumbled across all our kids and they would just show up, and the pandemic put an end to that luxury. And now I'm trying things that I've never tried before in my 10 years of being the camp director. So I guess we'll have a jumping off. What are some challenges that people are going through with their recruitment process right now?
Well, we're from a small town in Mississippi. Our nearest hospitals are like 2.5 or an hour and a half away. So we've always had struggles getting into the hospital. It's always been word of mouth. Something that I did last year, and I shared it with our region. I pulled a list of all the schools in the state of Mississippi and Alabama and Tennessee. And we just kind of picked the schools within like 3.5 hours. And we sent a postcard to each one of those schools. And that's how I got 5 new campers last year. And one of them happened to have been a patient at St. Jude. So that kind of built a relationship with that family. She actually walked in and took 500 flyers and brochures into St. Jude, talked to the principal, talked to the social workers, talked to the research and development team, who all said, "Oh, we've never heard of Camp Rising Sun. We'd love to help." And so we've had a lot of response from that as well, but just reaching out to the social workers. And then I would recommend just doing a postcard to the schools or the churches in the area. I mean, a lot of times when their kids get sick, they just want to start going back to church again if they haven't gone to church before or something like that. So that could be a really good way to reach people. I mean, we've done radio advertisements, we've done billboards, and that kind of stuff just hasn't worked for us. It was kind of like a waste of money on our end, but we have had response from postcards. So
Jason, did you also find that the postcards on those that you sent, Cole, did it also reflect in any kind of fundraising response?
We weren't really going for that. Mostly what we sent was just a flyer, trying to reach out for the campers. So we haven't had any response as far as like for fundraising efforts. Again, like we sent it to the school principals and the counselors. So we didn't really push for anything more than campers. But also, like I just sent, and just to give you an idea of the cost of it. Now, this last year, whenever I did it, I hand addressed all the envelopes and did it myself. This year I designed a postcard on Vistaprint, and I'm sending 3,500 postcards out for $1,800. So probably going to be the cheapest form of advertising that we've done in order to get them into the hands of people who know the kids.
One of our challenges right now is not being able to get into the clinics. We used to have a presence in the clinics, and they are still not opening back up, or at least I should say they're saying they're not opening back up. We've heard from families that other larger, more established camps have presence within the clinics, but they're not opening it up for us. So that's definitely been a really big challenge. And I'm wondering if anyone has any suggestions or workarounds for that.
Yeah, I've actually been on some coffee dates with some child life specialists and social workers because they said I can't come into their clinic or their hospital, but they can meet me and figure out a method to try to get the information to them to then produce it to their families or their campers or whoever your camp might serve. It's a very interesting method, but it's actually become very successful. Actually, I had a child life specialist come and volunteer at camp after that. So that's kind of something I've used to work around that.
It's a really smart idea.
I'm from Canada, so I'm not sure that I necessarily fit within this, but we too have undergone similar problems and all that kind of stuff. And what we're doing, because there's been so much change, even where the clinics are located, have physically moved, of course, retirement because of that, all the things that have kind of come out of COVID. We're doing a number of lunch and learns. So it's anytime, it just seems like when you offer free food, people like to come. And so it's been a bit of a sales pitch that we're just starting to roll it out, but there's certainly been some interest, and it's very similar to what you're saying, Julianne, in that rather than go on there and actually be on the board and doing the sales pitch ourselves, it's equipping them with the knowledge and the information so that they can sell on our behalf, if you will. So we're doing a similar thing.
And you always show up with a pamphlet or 200, and and that gives them an attainable thing to hand to their patients if they're inpatient or anything like that. Hey, think about this. If you're feeling up to it, maybe apply.
The other
Gail,
thing
are your lunch and learns are for medical staff?
they're for the medical staff. That's right. Yeah. For the social workers, the child life, the nurses. That's where all of our referrals come from, is from the medical team. So it's getting back in that door and doing that kind of. The other thing that we're doing is we're holding a fundraiser in 3 weeks. And on our wish list that we hope to obtain is we're wrapping a room in the pediatric ward. I'm not sure if it's done where you are or whatever, but it's literally an organization that does. We get to design it, and the whole room is wrapped. So some of the things will be erasable. So it can be a tic-tac-toe that can be erased. It's got a riddle, but it's all promotion of camp all the way around it. So that room will be known as Camp Circle of Friends. Just for interest's sake, our cost on that is about $5,000.
So this year, for the first time ever, my mom is a case manager, so she always comes home with lunch boxes and umbrellas and hats from all these long-term care facilities. And my dad and I kind of looked at each other at the dinner table and thought, well, why aren't we doing that with our child life specialists that we work with? So we serve about 19 different hospitals up here in New Jersey and New York, Pennsylvania. And I sent out a bunch of packages with Happiness is Camping hats that we actually got from Vistaprint at a really nice price. And they gave us a big discount, like a big coupon discount with it as well. And I needed something, then I put pamphlets in there, put the brochures, flyers in there. And I needed something to stuff the box with so that the hats didn't slide around. And I stuffed it with just leftover Happiness is Camping pillowcases that we had laying around. And wouldn't you know that I had more responses about the Happiness is Camping pillowcases than I did about the hats and everything. And what I found is we have nicer connections with some hospitals than we've ever had before, because there's been a lot of child life turnover with the hospitals that we work with. I don't know if you've experienced that too, but it really opened the door to people that didn't really know who we were. And everybody likes free things. So once you go home and see a hat, it's on your mind a little bit more. And then another thing that I wanted to talk about that was really successful for us last year, and hopefully we'll be doing it again this year, was partnering with other organizations or foundations that serve children with cancer but don't have their own camp programs. So we found two different organizations. One's called Embrace Kids, one's called the Ashley Lauren Foundation, and they provide they provide funds to children on active treatment for transportation and everything, but they don't have their own camps. So I reached out to them, to their executive directors. I met with their executive directors, and it became this symbiotic relationship where they would tell all the families that they work with about Happiness is Camping. And then we told all our families that go to camp about their services. And now we were both serving more kids than ever before. And it was a really nice cycle. And that worked really well from us. So I definitely suggest and recommend doing that, because it was really nice. And now you're getting to serve kids in two different ways. Does anybody else have any recruitment recommendations, questions that you wanted to get off your mind?
I have a question. Has anyone ever successfully partnered with the Leukemia and Lymphoma Society? I saw that they're doing a big event in San Francisco. It's called the Big Climb, which I think they do nationally at different places, and they get sponsored. And every one of their events that I go to, they seem to have vendors there. Camp Kessem's there, but we are never there. So I was trying to reach anyone there, and they're very hard. It's very hard to even find contact information. And again, I know fundraising wise, we would be competing with them, but we don't want to fundraise. We just want to get the information out. And it seemed like a great, kind of like you said, sort of partnership, but I'm having trouble connecting with anyone. Has anyone had any success with the Leukemia Society?
No, but I've had similar experiences trying to get into the really big national organizations. And like you said, it's like you can never get to the right person, or you just fill out one of the contact forms and you never hear back from the contact form.
The only way I've worked with our regional Leukemia and Lymphoma Society, and not necessarily for camp, but was at one point in time, I was on their patient services committee. So I don't know if somebody within your hospitals is represented on one of their committees that may be able to be in. So I don't know, like working through the nurses or the physicians that you work with. That would be.
That lies one of the other problems, so much turnover. Like we used to have relationships in the hospitals that now we don't have. We did actually just get approval to go in to one of the hospitals in Sacramento. We did an annual pizza party, which is come learn about Okaizu and have some pizza, and it was very successful. And obviously COVID nixed it. So we just got approval from Sutter to do it. We're not allowed to serve the pizza, but we're allowed to send it home with people because they don't want people eating indoors together. But yeah, so as I reestablish our connections at the treatment centers, I'll see if anybody is also in that connection. I'm like, if you would even just put a flyer in the bag that I know you're going to give everybody, you know,
Yeah.
like, let me send you something. So anyways, I'm in that same kind of mode of just trying to be open to newer things.
So in Texas, it's a little bit different because most of the camps are associated with a particular hospital.
Mhm.
I mean, we take kids more than just one hospital. We'll take anybody who doesn't have a camp home in North Texas area. but I stole an idea from one of the other camps, is to make it easier on the clinic staff and the nursing staff. They just made a simple poster on Canva and put it up in clinic where people would see it with a QR code that took the parents to the application. Because even though we have a really good relationship with with our nurse and social worker and child life specialist, you know, I know that it's an extra, they get busy. And so in terms of like from the HIPAA standpoint, once they give the information out and they contact us, then I can put them on our mailing list, but they have to do those initial mailings and we provide them with everything. But they've liked the poster because if they forget to talk about it when they're in their clinic visit, on that visit, at least they can see it on checkout or check in, that kind of thing.
And Heather, if you check the chat, Mackenzie said that she has a family member part of the Columbia, South Carolina area, and would be happy to give you their contact information. And
Thank
then Katie provided a great segue into my next question. Kind of family referrals, word of mouth referrals, Facebook group referrals. Has anybody had a lot of success with that? Because I know in our post-program surveys, like 100% of families always say we would recommend camp to another family. And then I always bring that up in the spring, and it seems like only about 5% of families share anything about Happiness is Camping. So I'd love to hear if anyone else has had success with getting families to spread the word.
We've had success with getting them to join the Facebook group, but I don't know if it ever joins that. Also, we are adding, actually we started today, just being on Zoom for an hour at 10 and at 6 for new families to come and ask questions. So far, no one came, but we only let them know yesterday. So, but that's something that we're trying, is just having like office hours where people can come ask questions about camp, learn about camp. I have no idea if it will amount to anything or not, but we'll let you know.
Something we're trying, we just started trying, so it's not a success story yet. But we do have a few families who are really good at the word of mouth spreading. And so we have enlisted them into like joining this like parent advocate group where we're trying to meet regularly and kind of come up with ways we can reach those families, because the families know better than we do how they hear about us or other programs. So we're trying to set something up just with a small group of parents who have already helped spread the word and just kind of see if we can grow that momentum. Hoping it works.
That's a great idea. And I'll say along those lines, so the whole reason we started family camp was, one, we wanted to make a bigger impact on the family as a whole, but two, we realized that it was a great way for families to grow a little bit more comfortable with us before they send their child into the middle of nowhere with a bunch of strangers by themselves. So we started family camp in 2019, and ever since we have 80% of the families that come to family camp then also sign their kin up for summer camp. And our kids, we offer 4 sessions of overnight summer camp. And I say now about half the kids that we have are because they came to family camp. And then once they come to family camp, we have a much better rapport with their parents, and they do a lot more advocacy for us. And those kids are hooked on camp now, and they're the ones that are coming for all 4 sessions of camp, and their families are fundraising for us. So we've had a lot of success, and I don't even know where we'd be today if we hadn't started with family camp and using it as we call it gateway camp, because once they get into family camp, we know they're going to come to summer camp.
I'd like to share that we take that one step back even from that. We do the family camp. Again, we serve kind of a broader area, and we offer one day sort of local, we call them family picnics. And you come from family picnic in Sacramento or in San Jose. Again, a chance, since you're not going to want to send your kid into the woods with strangers, to come and meet our staff. You know, the strength, I'm sure, of all our programs is our staff and our volunteers. And once parents can come and see that sort of happening, again, it sells them on coming to camp. I have a bunch of folks who come to camp now who started at a picnic and then moved to a family camp and then finally sent their kids to camp. So it's a good model.
Ryan, I was gonna ask you, so we're doing family weekend is what we do, a Friday through Sunday. It'll be my first family camp since starting with Camp Happy Days, but also our first family weekend since like 2019, I think. I'm interested to see the turnout with, how many of those kids will come to camp after offering it in the spring. But do you guys set any like parameters there? Like, for example, we only invite newly enrolled families or like newly diagnosed, I think diagnosed within the last 5 years, but likely have not been to camp yet. What are y'all's parameters you set there, if any?
That's a great question. So we can host a total of 15 families. And what we've found with family camp is that a lot of families cancel at the last minute. And when a family cancels family camp, it's a lot more devastating than just an individual camper canceling in summer camp, because it's essentially as if a full family or a full cabin of kids canceling at once. So to answer your question, Katie, our parameter is that we really we prioritize campers who have never been to Happiness is Camping, because we're trying to spread the word. And that's what it was always intended for, but we've realized that so many families will cancel at the last minute that we overbook and allow all families to sign up now. And we've still never had too many families show up for family camp. So we prioritize new families with that program, but have opened it up in the recent past to all families, and they kind of fill in any extra spots for us.
We do the same. We prioritize new families, but we also encourage a lot of returning families. The support kind of across the board from people who are further out versus people who are just starting provides a lot of depth.
Yeah, that's really interesting. I don't know what it was prior to COVID and before me joining the team, but I'll be really interested to see the turnout because we rent our camp facility for the summer. So for family weekends and anything else that we do in that nature, we're paying based on the RSVP and booking those rooms based on what families say they're coming. So should be very interesting, but I appreciate that insight because I'll definitely consider that once we have our first family weekend and kind of see how that looks.
I'm curious, Ryan, does the family share why the cancellation at such a late time?
So last year was crazy, Gail. We had a full camp. We had 15 families and we were really excited about it. And I woke up the morning of family camp and I only had 5 families left who arrived. And it was pretty devastating. And to be completely honest, we do Friday to Sunday, and the Friday of check-in day, it was raining all day long. So we think that families just decided that it's raining, we don't want to come to camp anymore. We did have a few families say that they were either exposed to COVID or had COVID. So that was a big reason, but a lot of times it's as simple as the family just doesn't show up. We go into New York City a lot of the times, and a lot of the families in New York City don't have transportation, and we don't know what the child life specialists are telling them, but I'll call them and ask if they're coming, and they'll tell me we never planned on coming. We don't have a car. We don't know how we were supposed to get there. So over communicating and overbooking, that's all I could recommend.
Well, again, I have been doing registration for family camp for a long time before the pandemic, and it was always an issue. I kind of got to a place where I could overbook by 10 families because I knew, again, we had more flexibility in our site at that time. So if we did have the extra families show up, we could just throw some tents up. But it is an issue. And again, any, families in general, someone gets a cold, someone gets sick. A lot of times it also, maybe like the mom wants them to go and the dad doesn't, or the dad wants, there's a fear issue because it's being emotionally vulnerable. So I think it's hard to get those people, and it's super hard you can never ask the people who didn't come what you could have done that would have helped them to get there. That's been a frustration of mine.
I'll say I guess with our parameter of like 5 years since like within diagnosis date, that has allowed, I guess in a sense, families that have come to camp but can still come to family camp, to get in the mix of the newer families that have never been to camp. So it helps, but it will be really interesting, and it'll be a huge letdown. If that happens, but it does happen with a lot of our programs, so should be interesting. I will definitely follow up on how that goes for us, because it'll be my first experience for family weekend.
Well, good luck. Family camp are some of my favorite weekends of the year, and I never knew that it would make the impact that it does. So I'm excited for you, even though we just spent the last 10 minutes scaring you with registration numbers.
It's fine. It's fine. I'm used to it with just like regular programming and camp itself. I mean, sometimes we do everything we can for families to make it to actual summer camp, and literally a day of, they're like, oh, we can't, sorry. So it happens.
So I'm tired, I guess, working all day. So I didn't think of another kind of, I think, unique recruitment that we've been working with a couple other camps, Camp H-Town, and with Rich and Camp What You Want to Do, and to do a kind of a camp collaborative for, I don't know if you guys have heard of the camp show. And so we're doing virtual weekends, and we're working with the hospitals. Our numbers are low, but we're working with the hospitals to invite kids who haven't been to camp to come to a virtual weekend. But we have had success in terms of the kids that have come. We spend a good, not a good part of the time, but we spend a couple of sessions during that time frame talking to the campers, and usually their parents are pretty close behind them about the camps in their area, and see how much fun you had at virtual camp, and what we really want you to experience this summer is summer camp. And then we hook those kids up to the camps that they would be eligible for based on where they live. So and we've had a return on investment in terms of some of those kids that have come to camp, the camp show virtual camp, then going that summer to the camp from their area. But like I said, our numbers have been low, probably about 10 or so per session. But we're trying to grow that and get more people involved. And we just thought maybe that's a way to take the fear out of it. And we just came off of last weekend doing a session, and we had parents really participating in the songs and that type of thing too. So they get a little look at what can't be, even though it's on the screen instead of outdoors.
Well, then I guess, Jennifer, that's a good segue promo point for us, because Jennifer and I are actually going on a podcast tomorrow called Help and Hope Happen Here. And it's a pediatric oncology podcast. And so I found them on Facebook, and we reached out to the host, and he said that they have about 2,000 listeners per week. He tries to put out a new podcast episode every week. It was just a passion project that he started over the summer over the pandemic, because he used to go into schools and do programs for kids with cancer. And obviously the pandemic put an end to that. So he pivoted to podcasting. So we'll be going on tomorrow and sharing the message of COCA in all of our member camps. So hopefully we'll be exposed to at least 2,000 new families that can hear about our membership and what we all do.
Yeah, we're excited about it. I'm just tagging along. Ron's a star.
That's not true. So we have about 5 minutes. Does anybody have any closing thoughts, closing questions before we wrap up for the evening?
I'd like to make a comment. I know it sounds to me like we're the only camp that's actually choosing to downsize in the first year. This will be our first year kind of kicking it back into full gear. And because of COVID, there's been a lot of newly diagnosed that have just kind of slipped through, or certainly slipped through our fingers, or finding that contact. So our goal is to reduce numbers, not quite by half, but very close to half, and manage it that way. So I think I'm the only one from everything I gathered around that would be the perspective. We're the only ones doing that. Is that correct?
Intentionally, yes, I think.
We are having lower numbers. We changed the age range we served last year. We used to start at 6 years old, and all of the things we heard about, the kids who were so young and at home and hadn't been to, kindergarten yet, or first grade, like it wasn't. So the 6-year-old was really, socially not ready. So we upped our age limit to 8, and we required COVID vaccinations. So that limits who we can have. We also had a facility shift, so we're able to serve fewer people because we're renters now. So we're not intentionally, but definitely serving less.
Yeah, and Gail, I was going to mention, I know of a couple other, American camps that are also going back to overnight residential camp like you guys are for the first time this year. And if you want to connect with them and just, have some comparisons and have a chat, I'd be happy to put you in touch with them.
That would be great. Thank you, Jennifer. One of our challenges will be, I see that we've got a lot of long-term campers. Our view is they'll fall off themselves when they're ready, as opposed to us booting them out. So, but as the time's gone on, there's an awful lot that have been, 6, 7, 8 years from diagnosis. So there really isn't cancer in their lives, with all due respect. So it's those families that will be sifted out through this process, I would think. And from where our medical team sits, it's, those are the kids that are ready to go and experience a healthy, normal camp rather than a cancer camp. So that's kind of our perspective.
And then just before we wrap up, so Katie put a comment that they're also having great success with virtual camp as well. It's a nice way to reach the kids who are maybe too sick to come to camp or not ready yet. And then once they do, they see that little camp magic and then they want more and come in person. That's great. And then Gail, also, so our facility, we could accommodate 150 campers, but we've always intentionally chosen to decrease that in half. So the most we'll accommodate is 75. Last year, we averaged about 50 to 55 kids per week, and we'd like more than that, but I don't think we're necessarily aiming for 75 anymore. So I think our sweet spot has decreased, but we do want a little bit more than last year. So.
Great. Thank you for the feedback.
Absolutely.
And well said, Ryan. Can I ask you, Katie, what camp are you from? Is Katie still here?
Sorry, can you hear me?
Yeah.
We're Camp Happy Days, so we're based out of Charleston, South Carolina, but we serve the entire state of South Carolina.
Got it.
So
I have some follow-up questions for you about virtual camp. We just have never had much success, I think.
Yeah, no, definitely. I'll put my email in the chat right now. COVID started it, and then it will probably be a norm for us from here on out. So yeah, I'm happy to share more insight on that. It's 4 days full of camp, and it seems crazy being all on Zoom, but it's like really, it turns out to be really fun. And it helps a lot with recruitment and the kids that are admitted currently and can't come to camp in July. So
thank you.
Yeah.
All right, so we hit 9 o'clock. If you have any questions or would like follow up to the group, just let us know. We can kind of broadcast that out to everybody. But thank you all so much for taking an hour of your time to discuss these two very important topics. And if you have any questions, just reach out. But it was great seeing everybody. We miss seeing your faces, and hopefully we'll get to see them a lot more this spring.
Thank you, Brian. Thank you, guys. It's great to be with you.
Thank you all so much.
Thank you.
Thanks, everyone.
Thank you.